Hi, my name is Dr. Benjamin Pulley, and I'm a neurointerventional surgeon at Pacific Neuroscience Institute. I'm essentially a stroke doctor who treats patients with bleeding strokes or strokes that are caused by a blockage of an artery in the brain. And I employ minimally invasive techniques to treat patients who have suffered from conditions like this. So my patient populations are essentially either of two groups. Like, you either come to me when you have like a stroke, you have an emergency, and you see me in the emergency department. And then that second group of patients, they have certain risk factors or conditions that may cause a stroke at some point. Like, for example, they have an aneurysm or they have a narrowing in like one of the arteries. Once that's discovered, then they can come to me and see me in my clinic, and we can talk about what to do about this and what the best treatment options for these conditions are. I think P&I is fairly unique that it really focuses on neurosciences. So we really have like experts from like neurosurgery, from like neurointerventional surgery, neurology, all under one roof working together. And I think that focus is fairly unique and it's really to the benefits of our patients. I really believe in individualized precision medicine. And I think we're at a point, especially with the neuroimaging that we have available these days, that we can really provide individual care to patients based on all the information that we have, and like really come up with the best treatment plan for every individual patient that I'm seeing. I'm mostly at our two Valley locations, so at St. Joseph Medical Center in Burbank, and then at Holy Cross Medical Center in Mission Hills. Seeing those rapid clinical changes in patients that are just like very disabled when they come in, and then seeing them, potentially go home like 2 days later and like walking out of the hospital, that's probably the most rewarding thing about this job.